It's almost autumn. Happy almost autumn to everybody. Holy cow. Where'd the summer go? I know where summer went. So, I want to welcome everybody who's live here with us on this hybrid hearing, talking about important matters at DHS and the great state of Minnesota. It's funny how you can get out of practice center often, you know. Just we got it figured out though, pretty good.
I think you got it.
Yeah,
Senator Abel, I do. I think it's just
yeah,
kind of chilly in here.
So today we're going to be talking about the homeless and housing support grants audit by the OLA, and what I'm hoping to do here is a little different than what happened in the Legislative Auditor, or the OLA, whatever the hearing they had before is not just the same thing again, but just chapter 2. And so to enhance some of the comments, go a little deeper, we are the topic, area, the experts, yeah, sure, charged with the topic. And to look at some of that and hear from the auditor with their highlights in what they're going to say, and then hear from the commissioner. And then we have one testifier in the public testimony that I know, and then we'll have a discussion. So welcome to the committee, and please introduce yourselves, and Ms. Randall or Ms. Layson, whichever one you want to go first, please.
Thank you, Mr. Chair and members. For the record, my name is Judy Randall. I'm the Legislative Auditor, and I'm here today with Lori Lyson, who is the Deputy Legislative Auditor for OLA's Financial Audit Division. Mr. Chair, thanks for having us here today to talk about our audit, looking at DHS's oversight of the homelessness and housing support grants. Ms. Lyson is going to get into some of the details of what we found in that audit, but I wanted to just take a step back and first talk a little bit about grant oversight in general. It is an area where our office has concerns across all of state government, frankly. Grants pose some unique vulnerabilities, some unique risks, because the state isn't necessarily the entity that's ultimately receiving the services. We are paying another entity to provide services to a third party. And so we need some additional processes for oversight to make sure the right people are getting the funds, and then to make sure they're spending the funds in the right way. And so, as I said, this audit is going to talk about concerns we had related to DHS's oversight of grants in 2 divisions. But I wanted to note that we have released similar reports in previous years about DHS and other divisions, where we had many of the same findings related to grants oversight. So this is an ongoing concern we have at DHS across multiple divisions with many of the same findings. But as I said, this is also a concern we have across state agencies in general. Tomorrow, we're going to be releasing another audit related to the Department of Health's oversight of some grants. And then later in January, we're hoping, we're going to be releasing an evaluation looking at grants across several state agencies, including the Department of Education and the Office of Justice Program at DPS. So my hope is that with all of this information that we're going to be bringing to you in the next couple months, we can really work together to figure out what type of oversight we need for grants, where the legislature can maybe strengthen some processes, and where agencies can strengthen some processes. Because I think at the end of the day, we all want to just make sure that these funds are being spent the way they should be and the way we intend. So looking forward to partnering with you as we continue these discussions. But for now, I'll turn it to Ms. Lyson, who will talk about this report in particular. Again, thanks, Mr. Chair, for having us.
Well, and thanks, and I appreciate your diligence on making sure that all the nearly $50 billion that we spend a year gets spent to do the task that it's designed for, and that those are, in fact, worthy tasks. So thank you. Welcome to the committee.
Good morning. Good morning, Mr. Chair and members. My name is Lori Lyson. I'm the Deputy Legislative Auditor for the Financial Audit Division. And today I'm going to go over our audit of the Department of Human Services, the Homelessness and Housing Grants. Next slide, please. The objectives of this performance audit were first to determine whether DHS had complied with applicable legal criteria. And here the criteria that we used was the Office of Grants Management Policies. Going forward, I'm going to refer to the office as OGM. And DHS internal policies, provisions of the grant agreements, and also relevant statutes. Our second objective was to determine if DHS had adequate internal controls over these grants. And then our audit scope was July 1st of 2019, so pre-pandemic, and then through December 31st of 2021. Next slide, please. So the Department of Human Services has two primary divisions that oversees the grants related to homelessness and housing. That first division is the Housing and Support Services Division. They provide housing support to persons with disabilities and those over 65 who are also considered to be low income. And then the other division is the Office of Economic Opportunity. They provide access to food, temporary housing and shelter, and training on financial literacy. Our audit also included two types of grants. One we're going to refer to as recurring grants, and those are grants that are awarded biannually by both divisions through a competitive process. And then those existed also before the pandemic. And then there was the COVID-19 Response Emergency Services grants. These grants were there to provide additional shelter, food, staffing and isolation spaces for those who are homeless or for those who are not able to isolate safely in their own environment. These grants are awarded through an internally developed process at DHS, and they combined elements of both single source and competitive. And then the grantees included local units of government, tribal government, and nonprofit organizations. Next slide, please. So this graph shows the final funding sources for all homelessness and housing grants during our audit scope. You'll see that the state funded a majority of the homeless and housing grants prior to the pandemic, and that began to shift in fiscal year 2021, when DHS received approximately $35 million to address homelessness and housing during the pandemic. So majority of the COVID-19 grants were paid initially from state funds, and then later most of those expenditures were then reimbursed by the federal government. I just also wanted to note that that third column here for fiscal year 2022 only includes 6 months. Next slide, please. So our audit results show that DHS did not always comply with grant requirements and also had significant deficiencies in internal controls. And I just want to go over the importance of internal controls. They're there to assist the agencies in making sure that they comply with the applicable legal criteria. So our report includes 9 findings, which touch on all aspects of the grant process, from awarding of grants to closing out of a grant. But today I'm just going to focus on 2 findings that we believe that are most significant to: 1, ensuring that grantees are equipped to receive state funding; 2, ensuring that the funds are spent on allowable cost; and 3, to ensure that the grantee has adequately addressed or met the program outcomes. So for each finding, what I'm going to do is I'm going to discuss what is required, the possible effect if that requirement is not met, and then what our testing found. Next slide, please. So agencies are required to evaluate the financial stability of any entity that is requesting a grant for more than $25,000. This is one of the first steps in ensuring that a grantee has the financial ability to address the objectives of the grant. The OGM policy specifically requires the agency to review either an IRS Form 990, an internal financial statement, or a certified financial audit. Then the agency must note what financial document they reviewed and any significant concerns that were noted. And this documentation must be kept in the grant file. Our testing showed that DHS did not complete a financial review for 91 of 117 grants. For the remaining 26, the document was insufficient. For COVID grants in particular, DHS saw many new grant applicants, which makes this requirement even more critical, as applicants are not familiar to the division that issued those grants, and DHS would not know whether the applicants are equipped and stable to financially meet those audit objectives, or those grant objectives, excuse me. Next slide, please. Agencies are also required to conduct monitoring visits for grants over $50,000 at least once before final payment is made, and annually for those over $250,000. Monitoring visits are a critical step in grants process to ensure that progress and outcomes are being made by the grantee. OGM policy specifically recommends here that monitoring visits can occur on site, although they do permit those visits to occur by phone. The policy also recommends the use of a standard form to allow consistency among grantees. And then once again, that documentation for those visits must be kept in the grant file. So in our testing, DHS did not complete visits for a majority of grants. For example, DHS did not conduct visits for 93 of 109 COVID grants. So what that means is that DHS does not know if program outcomes are being met. Next slide, please. Here, agencies are required to conduct a financial reconciliation for grants over $50,000 at least once before payment, or before final payment. And I want to make sure that we don't confuse this with advance payment reconciliations, which is really just looking, it's using self-attestation and no source documentation. The financial reconciliations we're talking about here are really allowing the agency to review financial support and compare it to the established budget within the grant agreement. And then that will help the agency determine whether funding was spent on allowable activities. So the OGM policy specifically requires reconciliations to include supporting documentation, such as purchase orders, receipts, and payroll records. And once again, that documentation must be kept within the grant file. So our testing showed that DHS did not complete financial reconciliations for a majority of grants. Another example here is that they did not conduct reconciliations for 93 of 109 COVID grants, which this means that DHS does not know whether the grantee spent the money on allowable activities. So when monitoring did occur for both visits, which we addressed on the previous slide, and for financial reconciliations on this slide, documentation was often incomplete or not retained. So it is unclear in these cases whether DHS performed complete and purposeful monitoring activities. I just want to be clear here that when monitoring did occur or did not occur, so when it did occur and the documentation was insufficient or it did not occur, that OLA did not review the grantee to ensure that no fraudulent activity occurred. So we're not saying there is fraud, but we also cannot say that fraud did not occur. What's more concerning is that DHS cannot tell you this either. Essentially, DHS did not follow policies that would provide that assurance. Next slide, please. So I only covered the key findings regarding adequate oversight, but as I said before, we had 9 findings. So those additional 7 findings touched on all aspects of that grant process. Those additional findings covered such things as conflicts of interest, awarding grants, progress reports, and the closeout of grants. So in the interest of time, we picked those most concerning from the grants oversight perspective. However, I'm happy to answer any questions related to any of our findings. So Mr. Chair and members, thank you for your time this morning, and that concludes my presentation. Thank you.
Well, thanks. And there'll be ample time for discussion, but any questions off the top of anybody's head right now to the auditors? Okay. Commissioner, why don't you stay there, and why don't you come up, if you're comfortable, Commissioner, just being part of a panel here. Welcome in person. When is the last time you were here in person?
Wow, hard to remember.
I mean, it's been a long time, right?
Mm-hmm.
Thank you for coming in, and
Thank you.
nice to see Mr. Burdick there, and the other multiple humans in the room, so it's... Anyway, welcome, Commissioner. I know you have some comments prepared, so
Thank you.
go ahead.
Someone has my slide deck. Thank you. So 3 years ago, last week, I spent my second day as commissioner presenting my 90-day plan to a joint Senate committee where I said there's nothing more important for the Department of Human Services than to be trustworthy for the people of Minnesota. Trustworthy to the people who depend on our services to live full lives in community, and trustworthy to the taxpayers of Minnesota whose resources we're entrusted with to use them properly, wisely, and effectively. That remains as true today as it was then, and there have been no new reports of payment errors out of the department for the past 3 years. Next slide. We've had a year of solid audit findings again in the department. I want to point out a couple. The third one is the managed care entities using a majority of managed care funds received for expenses and quality improvement activities. And the bottom one, our single audit findings, our single audit report in 2021 went from 32 findings last year to 13 this year, identified no misspent or misappropriated funds in the 15 months of COVID-related funding audited to date. Next slide. We agree with the report's recommendations of work DHS should be doing as we process grant dollars, but we did not follow all of those recommendations for these grants. It was simply not possible during the COVID pandemic to do it all, given the urgent time frame. The vast majority of the grants in this audit were COVID grants expended from 2020 to 2021. I have confirmed that we did indeed complete the financial reconciliation of 143 of the 150 grantees receiving these funds and have returned $462,000 in unspent, not misspent funds to the funds from whence they came. We'll continue to follow through till we've completed a thorough examination of the remaining 7 agencies and accounted for all funds expended. As our OEO team in Children and Family Services and our other DHS divisions stand up our new contracts integration system, all the recommendations in this audit will be incorporated into their daily work, as they already have been in our Behavioral Health Division. What does that contract integration system do? First, it moves our grants and contracts work into the 21st century by converting the work from a paper to an electronic system for the first time in state history on a system called Agile Apps, not a decades-old mainframe system. It operates like those online ordering applications that keep telling you you can't place your order until you've completed every required field. It saves all the documentation in a central system organized by grant category, date of the work, who completed the steps, etc. And it will allow us to pull macro data to show compliance levels, speed of the work, number of times certain steps are problematic, equity in grant making, etc., etc. We started to make funds available within 3 weeks of the stay-at-home order. The normal time to process grant dollars when following all documentation procedures is 6 months. The normal time to request an exception from the Office of Grants Management is 1 month. Our housing teams intentionally prioritized rapid, nimble processes to distribute these funds as efficiently as possible. Those teams and I have received dozens of messages these past weeks thanking us for saving lives during the pandemic with these funds. During fiscal 21, 3,650 households were served in emergency shelters funded by the base appropriation of the Emergency Services Program. By comparison, over 8,300 households, 2.25 times more, were served with COVID response funding for approximately 18 months. Quote, yes to good process and accountability, but rather than standing in judgment on how good people met the challenges of those most in need in unprecedented circumstances, stand in awe that they were able to meet these challenges at all, by Tim Marks, former CEO of Twin Cities Catholic Charities, last week's newspaper. The lack of pandemic context in the auditor's report and the media coverage that followed it over the past couple of weeks was as painful to the entire housing and shelter community as it was to DHS. We showed this timeline at the Legislative Audit Commission. Want to show it again here. The BHD, Behavioral Health Division grants were mentioned in the media recently, and the housing and homelessness grants are in the center, as you can see. Most of you know that we started work in the fourth quarter of 2019 on what we called Operation Stopgap and Operation Swiss Watch to improve our processes in the department. And you can see the timeline along the bottom with the different arrows when different pieces of that system were completed, and the contract integration system in the Behavioral Health Division is now complete, and 800 plus contracts are in that system. We're going to talk at our advisory panel on Friday more about all the things we've done over the last 3 years to improve our processes. But of course, these audits were taking place at the time that we were going through those improvements. Next slide. In the last few weeks, I've been talking to my team about what happened in those early days of COVID, and I asked for this chart. This is our Behavioral Health Division. You can see the number of staff at the bottom, and you can see the number of grants that appeared in the department, especially here in 2020, in fiscal 20, at the beginning of the pandemic. And then after fiscal 21, when we had the largest HHS bill in history passed at the legislature. And you can see that obviously the huge increase in the number of grants that we are processing. Next slide. And this is our Office of Economic Opportunity and our Children and Family Services Administration, with the number of staff at the bottom and the number of grants at the top. And again, you can see the dramatic increase in the number of grants because of COVID and because of recent legislation going way up. Next slide. So in addition to our commitment to cross our T's and dot our I's to be trustworthy to the people of Minnesota, our 4 HHS chairs are well aware of our study this year of Leidy Klotz's brilliant book called Subtract. It's actually Subtract, not Subtraction. We'll be undertaking an examination inside DHS and in partnership with the Department of Administration's Office of Grants Management to see whether we can simplify and shorten the 85 steps it takes to make funding available to the providers for whom it's intended, to put it to work faster for the people of Minnesota. We're receiving increasing complaints from providers who worked to advocate for funding in the 21 budget session about how long it took for them to receive that funding. And I will say once again that the department manages over $20 billion in funding well every year. To look at this one audit and declare that DHS is a mess or in trouble is grossly unfair to the caring and competent people of the Department of Human Services. Last slide. Going forward, we intend to be as trustworthy to the people of Minnesota for getting funding out to our neighbors who need our support in an agile, more flexible fashion as we are to the taxpayers of Minnesota, to have a solid approach to accounting for funds spent, especially through an ongoing workforce shortage. Thank you.
Thank you very much, Commissioner. Any questions right now for the Commissioner? Senator Benson.
Thank you, Mr. Chair. And Commissioner, you and I have talked about a number of things. I was one of the people who requested the action plan that you spoke about starting 3 years ago. That action plan, and your actually being here, was because of really dysfunctional behavior in the department, CCAP fraud. I thought that we were going to get some attitude changes. You have absolutely sent a message that says we are going to have good processes. You talk about dotting I's and crossing T's, and sometimes there are too many T's and too many I's, so let's focus on what needs to be done. What I get a sense of is that there are a lot of people underneath that action level that still don't get it. With all due respect to the gentleman from Catholic Charities, he should care deeply that people who follow the rules and serve the people get the money and not just money being pushed out the door. He should care deeply. People in the organization at DHS should care deeply that money is actually going to people who need it and they are willing to be held accountable. Some of these problems predate. There's a cultural problem that predates COVID. And you have done some really straightforward work, particularly at the assistant commissioner level and above. But you and I had talked about compaction layer early on. And for those who aren't in ag, you develop a compaction layer when you drive over a field time and time and time again. And you keep planting seeds and you keep harvesting, but eventually that compaction layer gets in the way of roots going down. And so plants appear healthy and then they end up with shallow roots. The transformative work that you are trying to do, Commissioner, has a compaction layer, and you're not going to fundamentally change the department until you get through that layer. And this report tells me the compaction layer is still in place. And maybe some of these systems will make that change. Perhaps. Both Senator Abler and I have carried legislation to break up DHS because I am getting this sense after 12 years that the cultural change that needs to happen where accountability and delivery are balanced is only going to happen if there's some fundamental change at DHS. And so I think the next legislature needs to seriously weigh what the structure of the Department of Human Services looks like, because I'm afraid you're not getting through that compaction layer. So that's my speech. A couple of things. On the staffing requests, I just want to, for the record, were any of your staffing requests denied during COVID?
When she pops up, we'll take it. Commissioner.
Chair Abler and Senator Benson, I can't say for sure whether or not any of our requests were denied during COVID.
So, Mr. Chair, I was on
Senator.
the LCRC and the LCPFP, and I was on all the things. Not a single COVID staffing request was denied through that process. So all the federal money that came in for COVID, if there was a staffing request, that request was met. In addition, those folks who've watched these committees know that with every grant, when you look at the fiscal note, when you look at our spreadsheets, there is always an FTE count that goes with them. So when the commissioner, with all due respect to your staff, who says we are just understaffed, we have been funding that staff, and we have met every request. And so if a grant goes out, automatically there are FTEs included with that based on fiscal notes prepared by the very staff who are saying now there's not enough staff. And so let's be clear, the legislature didn't get in the way of there being people. If it's a hiring issue, I just want to know when we fund FTEs, where'd that money go? If it's not, if you're taking the administrative overhead that's allowed for funding and it's not going to the grant recipients, where's it going? So I think that's a follow-up that as we go forward should be dealt with. I think when a grant has an overhead allowance of 7% and that's supposed to go to funding staff, where's it actually going? And so for the members of the public who are listening and the journalists who will write the stories and say they were understaffed and in a crisis, every staff request was funded and every grant that was given had FTEs associated with it per the department's request and per the administrative overhead that's allowed in those grants. Federal funds have a little bit different administrative allowance, but again, through COVID, every governor staffing request was met.
Commissioner, do you want to comment, please?
Chairman Abler and Senator Benson, I've appreciated the conversations we've had over the last 3 years, and I appreciate you walking with us through our process improvements and talking with us about ways to do a better job. I remember saying in my first year that if we don't give people the tools they need to get their jobs done, we can hardly blame them when there are problems. And our contract integration system is finally giving people an electronic tool to make sure they check off all the boxes, keep the documentation, et cetera. And we're still in the process of implementing it across the department. I did want to add that we have a couple of quotes here from employees who've been using that contract integration system. One of them, a supervisor in our grants team, said, "I was extremely reluctant when first asked to be an early adopter. The system didn't seem to flow, and I felt it wasn't very user-friendly. After using it for several months, I'm a true believer. The contract integration system not only makes my job easier by tracking workflows and contract information in general, it allows me to partner with my program teams all the way through the contracting process." And another said simply, the contract integration system has helped me track down contracts from a staff person who left the administration and assign them to new staff easily. And these are the kinds of experiences that our staff are having now with the tools that we're making available to them. I will say, when I realized, looking at that chart of how quickly the COVID grants appeared on our doorstep at the beginning of COVID, there was simply no time to staff up. No time to go out and recruit and hire and onboard and train the kinds of numbers of people that we would have needed in that moment in history to be able to handle everything with every single step. I appreciate your comments about how the legislature has been generous in making sure that we had staff during COVID, and often having staff as we ask for grants. But I do have to say my experience in the last 3 years is when we get down to the end of the session, very often DHS sacrifices the number of FTEs in their grant requests. We get the grant money, but not all the FTEs we originally said we needed to get the work done. And so we had a couple of grants this last session that passed with the grant money, but without the number of FTEs that we said we needed. So that also happens over time.
Thank you.
Senator Benson.
And Mr. Chair and Commissioner, I'm glad that your staff is getting on board with the changes that you are making. This problem has gone on way too long. And I understand early COVID. March through June, everybody in this state was trying to get their legs under them, figuring out what needed to happen. But then follow-up was a significant issue. And as there was ongoing maintenance of these grants, especially with new partners, where there was more risk, and we saw the Feeding Our Futures risk that tipped the other way. And so we haven't found any fraud in the grants that were given out. So can you speak to a level of confidence that there was no fraud with these grants?
Commissioner.
Chair Abler and Senator Benson, we actually did perform the financial analysis that we needed to do for these grants before we sent them to anyone. We didn't keep the documentation, and we need to keep documentation, but we didn't keep the documentation, but we did an analysis. And we have completed 95% of the financial reconciliation at the end of the grants. We didn't always keep that documentation. My understanding was on the original documentation of the analysis, we kept only the ones that we had some questions about and we needed to get resolved about, not the ones that completed the 100% of the analysis with no problems. And so it was the question in this audit of documentation, not that we didn't do that work. And the team that did this work is one of the best in the Department of Human Services, and I'm confident that they did a good job of it. They're going to finish the last 7 financial reconciliations of the final groups that didn't yet send in their final reports, and we'll see if there's anything to be found there.
Senator Benson.
Last question. So, Commissioner, for those folks that haven't sent in their documentation, do you still consider them eligible to receive ongoing grants, or have you put their grant eligibility on hold until they deliver documentation?
My team tells me that I'm sorry, Chair Abler, Senator Benson. My team tells me that the normal situation when agencies are late in returning their final reports is because they had no unspent money and there's not a lot to report, and that's why it's sort of hard to get their final report out of them. But we will finish all of those reports, see what we find in them, and see if there's any future changes in our relationships with those providers based on that analysis.
And
Senator
Mr.
Benson.
Chair, I guess to be clear, in my opinion, if somebody's not getting back the documentation that they should be, no money should be going out to them. And so I'm wondering if that's a posture the department's going to take to induce those folks to getting their documentation in.
Commissioner.
Chair Abler and Senator Benson, we'll have to examine the whole picture as we do the final reconciliation and ask ourselves whether that's warranted.
Mr. Chair,
Senator Benson.
I think it would be a good idea as you're going through this to send a message to grant recipients that they're going to be partners in both accountability and service delivery, not just service delivery. They need to help you. You have a lot of funds to manage, and the folks who do service delivery need to know that they're partners, not just in service delivery, but also in accountability.
Well, thank you, and there's some other members with questions, but I have a couple of comments. And Commissioner, I want to kind of assure you or reassure you, I don't think anybody is saying that DHS is a mess or in trouble. That is not what anybody is saying. I think the worthy auditors are doing their job to look over part of the $23 billion that we spend in the areas of the people that this whole room and all the watchers of this hearing, which have to number in this innumerable, care about. And so the trust of the public is what's at stake here. But I have to say, it's not a new discussion. You and I have had a lot of discussions going, in the past in your former role and in your current role as a reformer and as a stabilizer, and you've been just doing heroic work at that. But I just have to remind you that the department you inherited has a couple decades of audit reports with similar topics that had to be addressed from time to time, going back to 2001. And then it's the role of this committee and the House and the governor's office and you, whatever the commissioner at the time is, to take those findings and apply them as best they can. There was a time when I think there was a great deal of turmoil at DHS, and it could have been said it's a mess and it's in trouble. That is not this time. I think your watchful, caring approach, trying to redirect some stuff. I didn't know about the compaction layer, Senator Benson. Thank you for the, as a suburban guy, anyway, I think that's really important, and I think that's key in this discussion. So how do you get the will of the commissioner to get through to the rank and file how we do business? Mm-hmm. And it's a really hard job. And commissioners get eaten up in that process sometimes, and you've been durable and you're attempting to continue with that. So as we talk about everything today, this is not meant to do anything to describe the severity of problems, but it's an issue. And, you know, and I want to remind folks, and just Commissioner, you as well, and a lot of this you inherited, that the audit was about pre-COVID grants as well as the grants during COVID. And some of the same concerns that came up during the COVID time were actually predating that and actually predating you. And so now how do you as a commissioner look after this? And you put a number of good programs into place that are going to tick through. And it's taken a couple of years. And I think the public and the taxpayers are happy that there's an effort to make sure that the $23 billion is well spent. Because it doesn't come out of nowhere. It comes out of people's pockets and vacations and in their retirement money they would have put aside, that where we're choosing as a culture and a society to help people who are in hard times. But I actually, as I read the report, I should have invited Commissioner Malcolm to come because part of the oversight, progress reports were being worked through the Department of Health. And I didn't realize that till I read this report. I would have had her come along and explain how you were not able to talk to each other about these reports. It's on page 24 of the report. And so they have the stuff, you can't get it, which I think is an important, on the Office of Economic Opportunity stuff. I think that's really important. And I remember when I was back in 2011 with the $6 billion deficit time, it occurred to me to have the two departments talk about nursing home regulation. We had some meetings. They hadn't met. The workers leading this at high levels didn't even know each other's names. And I think the need for integration there continues. And that's just was something I was really quite surprised to see. And so, and I think that's, and I just have to react. I didn't know this until now about not keeping the documentation. I think that's a big deal. And I think I presume in your new system, all that stuff is kept. But I can't imagine that if you have an IRS audit and they're like, oh yeah, I'm sorry, I didn't keep my receipt for the donation, but trust me, I made it, and they're like, well, thank you for coming, and they're going to not accept that. And so that should be something that, that's a big deal. And so as I, going forward in particular, but, and there was one other group that sent in blank progress reports. There were 3 out of 8 quarters they had blank progress reports, and they still got the money. And so part of my conclusion to today is what I'll mention now, and then we'll go to other commenters, is that we have an Office of Inspector General, which is very dedicated toward all of this stuff, toward keeping integrity going. I wonder why they didn't catch some of this. That's my first question. But also, as they go out and manage child care, licensed homes and centers, the tone has changed a bit. It's more like, we're going to catch you doing something wrong, and here's now the citation, and here's a fine, or you have to fix it, which were all about accountability. But there was a time when they were about helping the entity to make a difference. I just spoke with somebody just last week. 20 years ago, there was a culture where they would try to help the nursing home or whatever. Like, this other company does this, why don't you try that? That might help you. And we have to mark it down, but here's some time to fix it, to a more hard approach. And yet, when the department itself hasn't checked progress reports and doesn't know the status of things, that's meant to be a minor technicality. And so the point I'm trying to make here is not to impugn the department. It was hard times. You have a lot of money, you have jobs, and you're working. But I think as a department, once you realize how hard it is to do all this stuff, that OIG and the people that are helping day services, licensed homes, the small players who don't have the resources, many of which are ethnically aligned and don't have as many as the resources on the equity level to even keep their businesses starting up, they want to serve. That there's an internal thing as well, Commissioner, that if you could take that back and say, how do we help them succeed? Gee, you've got 13 citations. Well, I guess that's the end of your license. No, you've got 13 citations. You seem like you're squared away in your intent. How do we help you succeed to serve? And I think if we take that home as a lesson, that'd be really good. And we've talked about that offline, but I see that as something really worthy. And I didn't have this hearing today to make the department look bad. We just did it today to have our dialogue about how is it going. And part of the dialogue at the end will be, the commissioner came in as a reformer. She's got a whole bunch of new systems in place that are working their way through. And so there's a good chance that this sort of thing is history. That's what everybody wants to know. But I think in the meantime, we have to explore and look at the present that we have. So do you want to comment, Commissioner?
Please, Chair Abler and Senator Benson, I think you've illustrated the tension that we've talked about many times in our work. We should be expecting the providers to provide every single form and document and get everything done and make sure they're accountable. And we need to be flexible and helpful to make sure that small providers, especially who don't have all the resources, are folks that we can help through the process so that they can continue to do their good work. And that's the tension in our work every day. It's the tension in our work in the Office of Inspector General, where we do want to be flexible and agile and helpful to providers and make sure we've documented everything for the taxpayers. It's the work we have in the grants group, where we are trying to be providing funds, especially in an emergency situation, and get them out where they can help people. And even in a non-emergency situation, get money out faster to the people that lobbied for it and got it in the legislature and now need to use it to serve people and make sure that everybody's crossing their T's and dotting their I's. And so that's just the sort of natural state of the Department of Human Services, having to balance those things all the time. We are looking at committing in the future to a culture of agility and flexibility and resourcefulness and responsiveness and accountability. And we're going to need to talk over the next years about reducing some of those 85 steps in our grant process and any unnecessary regulations that have built up over the years that do not protect safety and health and do not prevent fraud or abuse, but are just building up. And if we were to have a smaller set of regulations, a smaller set of grant procedures, then we should follow every single one of those while being flexible and responsive to the providers who are serving the people of Minnesota. And so I'll be looking to work with you over the next several years on finding a good balance between those two things and being able to go forward in a good way and find a good space that balances all of those requirements.
Thank you. Senator Housley, then Utke. Oh, your audio's not on, Senator. Sorry. Why don't you see if you can figure that out, and then I'll come back. I don't know how to help you. Do you have a 14-year-old at your house? I don't know, maybe the join audio button, I don't know.
Mr. Chair,
Senator Benson?
Senator Housley was our first remote speaker. Maybe there's something here that's not allowing it to feed
Oh,
in.
yeah.
So if we could have someone.
Let's try Senator Uckey and see if that
Check
works
out.
for him. How's that? Well, it says they can hear me on Zoom. Senator Uckey, do you want to take a run at trying to see how your sound's working?
Sounds like it's audio in the room issue.
Oh. Senator Uckey, do you want to just try to say hello? Are you there?
He may be.
You had your hand raised too. Senator Nelson, do you want to say hello, just to see if we can test the system? If you're live.
Can you hear me?
Through the Zoom. Yeah. All right, so I think we've got a technology person here. So he looks like he's older than 14, though. Senator Hoffman, you had your hand raised. Why don't you go while we're working on the sound?
Thank you, Mr. Chair. There's a bunch of moving pieces here that seem to be coming out, and I wanted to go back and ask a whole bunch of questions regarding, how the content or the system was set up and you looked at. But this timeline, I think, pretty much answers that for us. I mean, you got a mix of grants that were given because of this nasty pandemic that we were in, and we were like, okay. And I think for that point, the department absolutely did beyond the scope of work that anybody was expecting, right? And they did a great job with that. But within those layers, what I'm hearing is that there's still a systems issue regarding integration or their lack of integration. And when Senator Abler brings up about the fact of contract integrations or integration between the Department of Health and Human Services, I couldn't agree even more with that. I think it's an important piece. And the thing that's always gotten me was you got one entity that oversees licensing, and then you got another entity that oversees the process or the program service delivery, right? And in multiple cases across the board within those agencies. And it's always been a question mark about how well are those agencies interacting or talking. And why I bring that up is this point. A few years ago, in this room or the room over, there was a conversation about cutting agencies, cutting services to agencies, and there was a 10%. And I'll never forget that one of those activities would have upset the apple cart regarding a federal dollar amount that was coming specifically under Title V, right? So it was a Department of Health provision. But within those Department of Health provisions, some of the services that were being provided were being established by the Department of Human Services. So there's this constant integration or activities of integration between the two agencies. Yet it's always a question mark about how well those agencies are communicating together. And clearly, the reports that we keep getting trend-wise show that just isn't happening on a basis that I would personally like to see. As somebody who's worked his whole entire life in Health and Human Services, it's always been that entity. And so I don't know what we can give you, and I heard you clearly, we give you grant money, but then we don't give you staff. We expect you to do the same thing with the same amount of staff that you have as you're doing that. And if we really looked at, the staffing needs of the department, right? How can we support the staffing needs? Are people doing what they should be doing? And that's what I think the commissioner has been trying to attempt to do. But getting to Senator Benson's point, it's not just that, but you got a cultural, historical entity that's been in existence for many years, and are we really questioning? Are they doing what they should be doing? Are you working smarter, working harder, doing a good job, right? And in the case of the pandemic, DHS did an absolute wonderful job of getting that money devolved out to try to get people housing. They absolutely saved lives. I have no doubt about that, right? That's not the point here, right? That is a point, but it's not the point. The point that you and Benson have been talking about is really, what are we looking at from a systems perspective? And so I liked your compaction layer to somebody who used to serve on agriculture, and I missed that. That was a well-done thing, because you really do look at what have I done for systems change. And Senator Abler, you talk about, what is reform? The commissioner 3 years ago absolutely reformed and has done some great things for reform, talked about transparency, talking about, I'll tell you, the folks that the Department of Human Services have working with us on a daily basis are bar none the best I've ever seen. And one's in this room. I'll say his name, Matt, right? Most accessible person that you have within, the agency. Those are some highlights, Jim, right? I mean, those are things. I think the deeper, again, and I'm trying to buy time so you can get to Housley.
You don't have to filibuster.
But I think what you're...
We have a plan.
No, what you're getting on, what you two are getting on is, how are we going to really look at this from a collective viewpoint? Why are we having two separate committees? Why do we have a health committee and a human services committee? Why aren't we looking at that combining so that we're all going in the same direction, Senator Abler? And with that point, I guess I'll just say thank you.
Thank you. Senator Housley, do you want to give it a run? Otherwise, we're just going to put a microphone up to a laptop. So
Let me know. Can you
there we
hear me
go.
right now?
Perfect.
Yay.
There you go. Thank you to the staff. They're amazing. Okay, welcome. Now, Senator Housley.
Thank you, Mr. Chair, and thank you for all of your comments. And Senator Benson, we are going to miss your institutional knowledge going forward, because I could sit and listen to you all day with all of the things that, maybe not all day, but thank you so much. Okay, so what I'm finding most disturbing with the whole legislative audit is when we hear at the end that DHS can't tell you if fraud occurred. That's hugely disappointing when you're talking $23 billion and DHS can't tell us if fraud occurred. And then Commissioner Harpstead, in your presentation, I heard the word trustworthy multiple times, and I'm thinking to myself, I don't really have any trust in an agency that can't tell me if fraud occurred and there was no documentation kept. I have been audited by the Minnesota Department of Revenue. If I didn't keep those boxes of receipts and said, I just did it, just believe me, it doesn't work, doesn't fly. So, I do think we need to take a serious look at overhauling the agency and more accountability. And like Senator Benson said, no staffing requests were denied. And yet we see the same pattern over and over, and the audit in 2018, 19, 2021, and then, Mr. Chair, going back to the big stack that you had, nothing's changing. So, we really do have to take a look at it and what that is and how we go about it, but we have to be the voice for the taxpayers, and to say that there's trust in DHS when you can't tell us if fraud occurred, it just doesn't sit well with me. Thank you.
Commissioner?
Yes, Chair Abler and Senator Housley, several things about that. I want to just say that several people have mentioned the culture of the department and what we need to do to make sure that folks in the department are all on board with being more accountable. The whole point of our contract integration system is we don't have to rely on people's attitudes. We don't have to rely on people coming on board with a particular point of view. People will not be able to process grants without checking all the boxes in the contract integration system. And so it's a way to not rely on who knows what, who remembers what, or who is on board and who's not on board with the culture of the department. We simply will have to step through all the steps in that process to process a grant. And so it's time we gave the department people that tool so that they can do their jobs well and have a place to keep all their documentation and to get past some of these issues. I want to be clear that I am not blaming the legislature for anything here. I'm just suggesting that we were swamped with this set of grants and with another set of grants after the fiscal 21 legislative session, and have not had enough people keeping up over the years with the number of grants that we're now processing. And it's a conversation we need to continue to have with each other and figure out the right balance of the staffing and the number of regulations, the number of grant requirements, and then this whole question of being flexible and responsive.
Well, thank you. And just to that, and on page 26, talking about, again, office economic opportunity, but it seems like it's throughout. You're concerned about these instances of noncompliance occurred due to staff shortages, insufficient training, and lack of review of monitoring activities by supervisors. I just want to remind you, Commissioner, you and your cadre are doing a really hard job in the largest agency in the state. That does not percolate all the way down. This compaction layer is true. So when you say, please recognize we tried hard, you get a letter from the homeless folks saying thanks for the money, we agree. We're glad the money got out. No one is arguing about that and about the good intent. But it's really important, if there's a takeaway from this at all, it's like you have to reckon, you as a department, it's not, you're not the department, you're just whatever, but the department has to recognize that people in the hinterlands are suffering from staff shortages and insufficient training as well. They are working ridiculous amounts of hours to keep their little agency going. And then here comes a paperwork request and the documentation was a little bit off. And they are pounded on and may lose their license. And so it's really important, if part of what got me going on this whole idea about the hearing was to talk about how do we make it work better. And the feedback that you're getting from us, I think is helpful and constructive toward helping you accomplish your purpose of making it better. So I'll leave it at that. Senator Utke.
Thank you, Mr. Chair, and thank you, Commissioner, and other members who are with us here today. But one of the things I think and a lot of the good topics or the good questions have already been asked, so I'm getting into a few of the other notes that I had. But when this auditor started, we heard that, this isn't something new, and this isn't just DHS. This has been a problem across all state agencies for quite a while. And even in the DHS report, it only starts in 2019, but the comment was made, again, this has been something that the auditor has seen over the years and that legislators have heard over the years. And I guess that's what we're looking for is from the current agency and the commissioners, what's the plan? How are we going to do things differently? And, as far as comfort level from our taxpayer, when the report shows 93 out of 109 of the COVID-19 grants had shortcomings, whether it was in the monitoring or the financial parts of it. Those are things that, we've got policies and procedures from before that the employees needed to follow, and then all of a sudden it appears, and then it was neglect, and basically they didn't do their job prior, and now they just, using COVID as an excuse, so to speak. I think we do have to back up a step and really look at what the auditors found. And this, again, like they said, is not the first time, and we've got to learn from that so that moving forward, the word trustworthy comes up. Well, that's where this all starts with our taxpayers, the people paying the bill. If we're going to be trustworthy so that they know we're doing the job correctly, we got to do more than talk about it. So that was one of the parts.
Senator Utke, can I ask you to, Senator Utke, can I just have you suspend for a second? Senator Nelson has to get on the road, so I'll come back to you if you don't mind. So Senator Nelson, do you want to say hello?
Oh, yes. Thank you, Senator Abler, and thank you, Senator Utke. Yes, I'll try and be brief. First, Commissioner, I stand with you, and I will help you when it comes to streamlining regulations. Regulations should be our friend, not our foe, helping us make sure that we don't see reports like we saw today. The right regulations will make sure that we don't get in a position like we were a couple of years ago with CCAP fraud, or a few years ago when the federal government, of all things, found fraud in our use of medications and telemed regarding mostly, I think it was addiction medications. And so you're right on the money when you talk about the right regulations. But because of the history that we have, I suggest that we'll work on this. We probably should start with the mindset, what regulations are going to be beneficial to the end user? So start with that in mind. And then I just wanted to mention briefly what I saw as concerning in the most recent OLA report. And it was that first finding combined with the others that really seemed to cause me a great concern, and I think many Minnesotans too, and that is that there was not conflict of interests were not examined. I think it was about 80% of the recipients, there was never a review of conflict of interest. That's a huge problem, especially when you combine it with the fact that in many cases, more than one, I should say, not many, but in several cases, more money was given out to the grant requester than what was asked. And I just find that really troubling when we have so many areas where we understand that needs are not being met. So I just want to mention those issues in conjunction and pledge to work with you on real, meaningful regulations that will make sure all Minnesotans know that fraud is not occurring, and secondly, that the end users are receiving the services that we all have agreed need to be given, and they're done without conflicts of interest. So thank you, Mr. Chair, Commissioner, and Senator Utke.
Senator Nelson,
I can
thanks.
stay for just a couple questions if the commissioner has them for me.
Yeah, so Senator, the commissioner is going to reply, so go ahead.
Yes, Chair Abler and Senator Nelson, just a couple things. Absolutely, we need to follow the conflict of interest requirements in our contracts, period. I will also say that we've been talking this year to especially provider associations, and we've challenged them to come back to us with ideas for regulation that does not protect safety and health and does not prevent fraud and abuse, but is in the way, especially during a workforce shortage. And we've received rich lists of possibilities from ARM, the Minnesota Hospital Association, Long-Term Care Imperative. We're talking to child care providers tonight, and counties are starting to look at things that get in the way of their ability to do their work in a workforce shortage that they suggest we might take a look at for simplifying our processes.
Thank you. Thanks. Senator Utke, do you want to continue?
Okay, thank you, Mr. Chair. And I'll just wrap up here really quickly because, again, most things have been covered. But, you know, the topic and the conversations around the compaction layer, I like that description because we've a lot of times used other descriptions too. But when we get down beyond the leadership level, changing the patterns that's been in place for years is tough. And that compaction layer is a great example of that, and we've got to figure out how to get through that, because if we're going to have true and real change, it's going to take everybody being on board. And the commissioner and I have had conversations over the last couple of months about the number of steps in the grant process. I think month or so ago, we talked about there being 53 steps, which seems, we talked about how unreasonable that was. And if it's actually 85, that's just incredible. We've got to figure out how to make these things easier to work with. There's no, to me, I don't see how 85 could even be, I mean, all that is creating a ton of problems because now you've got multiple layers, whether they're looking at it, processing it, just more room for error. So those are all things that need to be looked at, that we can do a lot better. And actually, from the legislative side, I say to the department, and we've said this many times over many different things, bring us ideas to the table. You guys work with it. Bring forward suggestions. When you engage with the providers, how can we do this better? What needs to be changed? Because this just seems totally ridiculous. But, you know, at this point, the report has showed the problems that are out there when we talk about the huge number of shortcomings. We need to start addressing those right now, and it isn't just all COVID related. When it says that this has been going on for years, again, we don't look back and place blame, but let's learn from the past and use it to do better in the future. Thank you, Mr. Chair.
Thank you, Senator. And Commissioner, do you want to comment?
Yeah, just briefly, if I could. Senator Uckey, we have talked about these things many times. The 53 steps, by the way, were to get money out the door, and the 85 are to go all the way to the end of the contract and finish the reconciliation. I will also say that I've discovered that many of those steps have been added by the department and not by the Office of Grants Management. And that's because we add a few steps every time we go through an OLA audit and need to say, hey, we need to do a better job, let's add some steps. And so I think we all need to step back, take a look at that whole process, simplify things, and then absolutely nail the steps that are left.
Thanks. And we do have a public testifier. Roberta Opheim is here, and I believe it's your birthday. So thanks for joining us on that. So we're not going to sing, but no, you all can stay here. No, it's online. Yeah. Let's go ahead, Roberta. Can you hear us? Oh, wait, here we are again. Oh.
Like she maybe told her.
Good morning.
There you go. We can hear you great. Welcome, Roberta. Ms. Opheim.
Thanks. Chair, members of the committee, my name is Roberta Opheim, and I know many of you from my years of service with the Office of Ombudsman. I want to make it clear, I retired a year and a half ago, and of course, being in the middle of COVID, I couldn't come and say my goodbyes the way we would all like to. So many of you may not even been aware that I retired, but I want to make it clear I am not speaking on behalf. But I spent 28 years as an ombudsman, and I spent time on City Council, I spent time on the Metropolitan Parks and Open Space Commission. And process is a killer unless you get down to a streamlined process. The reason I wanted to speak to you today is a follow-up on the Star Tribune editorial, asking the state to do something this time. They didn't say what, they didn't direct it. My observations are, first of all, this is also not about Commissioner Harpstead. She's working hard, she's got some good ideas, but again, she's the designer and not the executor. And it's at the execution level that we have a problem. No commissioner can handle the size of that department. They just can't and be on top of everything. The problem comes in, it's then delegated down to a deputy commissioner, delegated down to a director, and they each have their own ideas. So the commissioner may direct in one direction, but the assistant commissioners start to move in their own direction based on their own thoughts, their own bias in the system. You talked about the change of culture. One of the biggest things I saw was I would attend a meeting and nobody knew why they were there. Nobody knew what the outcome of the meeting was supposed to be for. And at the end of the meeting, people left not knowing what their assignment was for the next meeting. So we spent a lot of time rehashing the same information meeting after meeting. The staff in DHS, and I'm sure you've all heard this before, if they don't like the proposed changes, they will drag their feet. Because soon enough, they'll have a new commissioner or a new assistant commissioner, a new deputy commissioner. So, and then it all changes again. So you can't have, we have to find a way to transcend this process beyond one commissioner at a time. They aren't there long enough. Hopefully for Commissioner Arstead, she may be there longer, I don't know. But each political year, there's a risk of changing. And so people don't do much of anything before the election because, they're afraid to do the wrong thing, depending who may or may not win the election. The contract thing, the Ombudsman's office had dealt in contracts, and yes, there are a lot of steps and they can be frustrating. If individuals have enough time to work on it, and if they have a checklist, I don't know if they do or not, but do they have touch points with their contractors to say, how are you doing? What are we missing? How can we get moving forward? But what I wanted to say was this department needs to be thoughtfully broken apart into manageable pieces. I have my own ideas, other people have ideas. We had a committee a few years ago, and really nothing new came out of it. We didn't see any changes in day-to-day operations. And in fact, that's when, we saw the auditor's reports 19, 20, 21, 22. So I believe that it has to be looked at thoughtfully, but not assign that task to the department. Assign it, the other one was a Blue Ribbon Commission, and sorry about that. I just think it's time to take a serious look with the legislature involved. If you develop a task force or something else, the legislature has to be actively involved in it so that when the time comes, you're not just handed a list of changes and there's so many of them that you just put them through, most of which are probably good, one of which has something perhaps wrong with it that nobody caught in the end, or it has a side effect elsewhere. They also have trouble with grant money they receive from the federal government. They receive money for a variety of things, and often they sit on it. If they don't sit on it, they give it to the same vendors over and over and over again, which if you do that, it doesn't lead to the thinking. So I really would like the legislature to get very serious about breaking the department apart in logical pieces. You already have conflicts of interest, not just in grants, but licensing, licenses, state-operated services. The Inspector General looks at its own department and yes, should be able to do some of those things, but it's pretty hard when you're worried you're going to offend one or more commissioner appointees. I've seen so many changes over at DHS that the best idea, and certainly Commissioner Harpstead has some great ideas, will only work if there's continuity of the ideas past the changeover. And DHS has had a lot of changeover in their high-level people, and that makes it very difficult. Takes them several months to figure out what the department is doing before they can really apply it. So I guess with that, don't just break it apart, because if there is a commission task force that looks at it and says, this is how we should break up DHS, you still have to go delve deep to make sure there's not crossover or a problem, or if there is crossover with another division, how do we break that crossover and decide who's going to do that task? So I guess with that, I just want to say thank you for allowing me to express my ideas and opinions based on 28 years of watching things have money but not necessarily get done. So I'd like to see the blame game between the legislature and the department, one each blames the other, and see that and see a much tighter partnership, and the legislature doing much more of an oversight. Because when you get those recommendations and you just put them through, the ombudsman and others don't get to see them before they introduce them. And by then, too late to tell the department, we think this is wrong, we think this is wrong, we think this is wrong. So thank you again. And I really appreciate the work you're doing on this, and that Commissioner Harpstead is doing on this. Thank you.
Well, thanks, Ms. Opheim, and I would imagine it's the unanimous view of everybody watching today that you were remarkable in your duties, and that the efforts you made and the changes you made on behalf of so many people were just really quite incredible. So thank you for that, and I hope your day is special today. I just want to offer a thought, and we're kind of coming in for a landing here, I think, and the commissioner will get to speak again. But you broached the idea about changing the structure of the department in an effort to actually permanentize the changes that commissioners are really powerless to do all the time, just because of the very reasons you mentioned. Those are very real. Then Representative Thiessen and I, back in 2007 and 8, made an effort to do some changes, and we were not successful. In 2013, a report came out from MAD, Minnesota Management and Budget, about options for administering health and human services regulations. They suggested spinning off licensing to go to MDH, as well as that there should be more cooperation with MDH and DHS. The discussion is not new, and I think part of why we're having the hearing, and just to be fair to the people with concerns, the editorial written by the Tribune a week ago or 2 weeks ago, whatever, about this audit was fair. It's not what everybody wants to hear, but it's like, gee, we're kind of concerned, and there's no mess, but we're just concerned about the money. The editorial that they wrote a couple days ago, which is in the packet for people, says, I think it's time to look at this. And I've been persuaded about that for a long time. And I think we really do need to do that. And it's no impugning of anybody, but it's like time to make government work better. And what the format would be is anybody's guess. There's going to be 10 ideas about what to do, where, and how to combine, but I think that's a real discussion. And so with that, I'll let the commissioner comment, and then if anybody else wants to comment, and then we'll kind of wrap it up.
Thank you very much, Chair Abler. I want to make one thing really clear before I leave today. We do not have 7,500 unaccountable people with one strong commissioner in the Department of Human Services. The process improvements we're implementing today came from inside the department with talent that's been looking to make these improvements for some time. We simply enabled it over the last 3 years. And for each of the audits with findings that have been mentioned today over the years, we've had 5 strong audits in the same years. We've shared those for the last 3 years with our advisory panel because they never make the headlines. And so we've been able to share those with you in another way, so you can see that we've also had really great audits, in addition to some of the audits that have come across with findings. I will say that we have recently brought former Deputy Commissioner Chuck Johnson back to the Department of Human Services in a post-retirement option. He's examining the report that you just shared, as well as the 10 other reports I've seen about past examinations of the structure of the department. And he's back to help me think through all of those with his vast experience in the department and my 3 years of experience in the department. And together we're going to develop some recommendations for the governor in regard to the structure of the Department of Human Services. So you'll be hearing more about that over time.
Well, that's the O. Henry surprise ending of this discussion. I appreciate, Commissioner, your thoughts about that. And I think it has to come from the top. And I think someone like Mr. Johnson, with his experience, has seen, he would understand the pitfalls, and I think public dialogue with various experts. I think Ms. Opine would be a good choice for him to consult with, since she popped up today. And some others who understand structure with no dogs in the fight. And this is absolutely not anything beyond a policy discussion here. So, anybody else want to offer any thoughts? No. All righty. Senator Draheim.
Thank you, Chair Abler, and thank you for letting me sit in. I'm just glad we're having this discussion, and like everybody at this table, I think we've all had a bill to reframe our health and human service sector of the state, and it's just frustrating to me that over the last couple decades, we've identified problems, and the problems persist. So we can move forward, which is what I think we all should do, and have an action plan. So I guess I'm excited to hear the commissioner is working on something, and I'm unopposed. I will be back. I will be dropping my bill again to reshape our health and human service sector. And I would love to work with the commissioner and other members to try to have those checks and balances in place so we all can do a better job, so we can reach our goal of helping Minnesotans. You know, we pass legislation, we spend the money to actually help people. Let's make sure the money is going there to help people. And that's my frustration, is that there are simple things that could be done to do a better job. And I'll get off my soapbox, and thank you for having this hearing.
Well, I'm happy you stopped in, and I think this has been a constructive time. I want to fully commend the Office of the Legislative Auditor. They ask questions that need to be asked. They've got a track record of looking and being thoughtful and thorough, which I think in a $23 billion budget area is a worthy thing. We have a commissioner that I have a great deal of confidence in to continue to shepherd things. None of us know, except for you, Senator Draheim, who will be sitting in what chairs in January. There's nobody who can say with confidence that they are going to be in their chair, except for you, and I think another couple of others. And so, but I think the point of, actually the auditors will be sitting in their chairs, always ready at the watch. And I think that what we've queued up is for the next legislature, along with the next administration, to decide how shall we assure our citizens, taxpayers, those with the needs, and the operators of our services that we actually are committed to providing those services and to making a difference. And so thanks to everybody who participated. It is Jonathan Cotter's birthday. We do not have any snacks available, however. So with that, we'll see you next time. We're adjourned.